your Lead Left vodcast for the week of July 6th. I'm Randy Schwimmer. Welcome back. 2 years ago, we issued a special report on healthcare trends. We recently revisited one of our sources, a top healthcare investor. Everyone's an infectious disease expert, he told us. We need to change the way we look at infection. There are about 40,000 deaths annually from the seasonal flu. It affects infants and the elderly. Corona diseases have mutated. Real treatment is driven at the federal level, like seatbelts. With COVID-19, you need everyone to get vaccinated. How has government managed so far during this crisis? The CDC made some early mistakes on testing, he said. As with 9/11, certain people knew early on about the virus, but they didn't coordinate with other agencies. With COVID, we don't know what we don't know. We don't know if you can get reinfected. We do know washing hands and using sanitizers saves lives. What's been your biggest surprise? That entire economies and countries shut down, he said. That's because there was no plan. It needed airtight restrictions, it needed to protect the vulnerable, and it needed tests. I was actually surprised people stayed in their houses. What we also needed was a quick response. This was actually a mild virus. What if, with the next one, it's fatal regardless of age or morbidity? When we spoke in 2018, the future of the healthcare industry was to control the beneficiary. In other words, ensure end-to-end delivery of services to the patient. The CVS-Aetna merger had just been announced. We said the goal was to arrive at where insurance meets capitalism. Well, we're there. A lot behind the scenes still needs to get solved for there to be a significant reimbursement shift, but the current crisis should accelerate that trend. Next week, how is private equity thinking about COVID and the new healthcare? Reporting from the over-the-counter section at the Lead Left, this is Randy Schwimmer, wishing you and your families a safe and healthy week.